This is Michelle Baltazar from the Australian Filipino magazine, and I'm joined today in a live Zoom meeting with Dr. Angelica Logarta-Scott, a medical practitioner, and she's going to help us find out more about COVID-19, and Jesusa Helaratne, who is from New South Wales Health. She's always been very supportive in providing communications to the Filipino-Australian community. So, hi, Angelica. Hi, Dr. Angelica.
Hello, Michelle, and hello, Jess.
Hello,
it's nice
kumusta?
to be here.
All right.
And
Hello,
hello to
Michelle.
everyone.
Hello. So, yes, we would love to just ask you questions that we received from our readers about COVID-19 and specifically for the Filipino-Australian community. So, perhaps we'll kick off with you, Jess, to give us an update as of August 1. What's happening?
Yes, look, thank you so much, Michelle, and hello, Angelica. It's nice to see you again. And Michelle, thank you so much for inviting us here to have a nice conversation and also just talk about the importance of why it's really, really necessary to keep safe, to keep our state safe and our community safe. As of Saturday, August 1, today, we have had 17 new cases of COVID-19 that were diagnosed in 24 hours, 8 p.m. last night, bringing the total number of cases in New South Wales to 3,584. One previously reported has been excluded. Now, early this morning, an 83-year-old man who had COVID linked to Crossroads cluster unfortunately has passed away, and New South Wales Health extends condolences to the family at this time. I guess what's important to remember is that we should all know that there are 17 new cases today. 3 cases were travelers of hotel quarantine. 1 case is a New South Wales resident who returned from Victoria. 2 cases attended the Apollo restaurant. 2 cases attended a Mounties Club in Mount Pritchard. 7 cases are contacts of known cases, and 1 case is locally acquired and no known source identified. 2 cases are under investigation. And I think the most important thing for us to note is that if you have gone to these places or you know people, it's best to stay isolated. And to help this spread this COVID-19, Dr. Logarta-Scott will tell you to stay in, get tested, and isolate.
Okay.
Definitely. Yes. Thank you for that.
Thank you, Jess. So, Dr. Logarta-Scott, bakit ba kailangang maging seryoso ang mga Pilipino tungkol dito? Kasi sasabihin natin na 17 new cases, which sounds like a lot, but can you give us a perspective na, baka naman ang layo-layo naman nun, hindi naman yun mangyayari sa akin?
Ganito kasi alam naman natin na itong COVID-19, serious talaga ito. Hindi ito katulad ng mga ordinary flu lang, yeah? Kasi nakita naman natin ang mga things na nangyari sa ibang countries, di ba? Vast majority talaga, mild cases lang, 80%, Kaya a lot of people are thinking, it's okay, I'm all right. But 1 in 5, or shall we say 20%, will have difficulty breathing or will need hospitalizations. Tapos doon sa hospitalized na cases na yun, some of them will need ICU. And it depends on the population, di ba? Kung for example, 1 in 5, but you affected a lot of people, so that would mean that it will overload the health systems. And then if that overloads the health system will collapse in the hospitals. Other than that, yung mga health workers, kawawa naman, yung mga nag-work sa hospitals.
Yes.
For example, as of the moment sa Victoria, there are 3, I think, GPs, doctors that are currently in hospital. So kaya, ngayon we think that I am okay, but, think about those people na doon sa 1 in 5 na magiging mapupunta sa hospital. And, in the past, we think na, it's only the elderly, or it's only those people who have comorbidities, Pero when we look at the statistics in other countries, there are those who are hospitalized that are in their 30s. So it affects not just the elderly, not just the ones with medical conditions, but also those of different ages. And not only that, we can also think that even if someone is cured, they recovered from the COVID-19, there are still long-term implications of this. Long-term, minsan hindi na right yung paghinga nila, or minsan yung strength nila sa paglalakad, it's not the same, because it's a multi-organ condition. It affects the brain, the heart, kidneys, so many organs are affected. So kaya we have to take it seriously. Complacency, well, alam naman natin ngayon, because we've been about 5-6 months na yata with this COVID,
yes,
people are becoming complacent, but complacency costs lives. We have to take it seriously. We have to make sure that we're doing all the right things, the right choices, and discipline talaga.
And Michelle, the issue is right now, and we have to remember na lahat tayo, in the very start, we thought it was separated from us kasi wala tayong kilala na may COVID. Ngayon, it's really close to us. I mean, there are a lot of people that we know that someone who knows someone, or a relative who knows someone may have died. I mean, I know that some in the Philippines, one person we know here had COVID, and then her sister also had COVID in the Philippines. So it's spread across the globally. And I think what we have to understand is ang lahat ng mga people who are migrants here, who are Australians, mga kababayan natin, mga Filipino, what happens is we take information from outside, from other countries, instead of listening to what's applicable for us here. So we have to remember that na merong mga balita dito, and we're trying to make sure that the news that and the information that we spread are relevant to New South Wales, or if you're living here in the state, or as Dr. Logarta-Scott said, if you're in Melbourne or in other states, you take heed and listen to the rules and regulations that's been set up. Now in Victoria, everyone has to wear masks. Right now in Sydney, in New South Wales, when you visit health facilities, you should be wearing a mask. If you are admitted, then you will be given a mask yourself. You can bring your own mask from home. But so if you can't physical distance, then you should wear a mask. We don't know what the regulation will be in the next few weeks or next few days. Hopefully we just follow the rules. Also, one of the things that we have to remember na I remember, Michelle, when we had a conversation the other time, you said, ano ba, if I want to have, my mom's going to have a party, or friends are having parties, ano gagawin natin? How many people should be in it? Now, the regulations, the rules they say in the New South Wales government is you can have at least up to 20 people. But New South Wales Health really recommends the up to 10 people, because you don't know, you can't ever, it's really difficult to physically distance yourself. And just one, masasabi ni Dr. Logarta-Scott, isang ounce of ano lang yan isang flick of a saliva, or a cough or a sneeze, it can cause you so many harmful consequences.
Mm-hmm. So let's talk about, a lot of Australian Filipino readers are based in New South Wales. So let's talk about the Filipino community here. Maraming na malapit sa Campbelltown, where the Crossroads Hotel, that's quite close. And then we have a big community in Blacktown. And we also have, other kind of pockets of Filipino communities around New South Wales. But let's focus on Blacktown and Campbelltown. What's your advice to Filipinos who live in the area and they still plan to have gatherings, or they still want to catch up with, 20 people? So Dr. Angelica, anong masasabi mo dyan? We are social animals. So what do we do?
I know. Yeah, it's hard. But firstly, ang pinaka-importante talaga sa atin, halimbawa nag-iisip tayo na mag-social gathering, is to think about the safety. Okay? So firstly, kung kaya ninyong malimit less than 20, then do it. Tapos secondly, outdoor, the if it's outdoor, is yung air hindi stable. It easily blown away, aerated. So that decreases your chances, you know. And if you can think na malaki yung area, you know, outdoor, malaki yung backyard ninyo, and then obviously you can maintain 1.5 meters, then you can say now, yes, medyo okay, medyo possible iyon, you know, because you can maintain 1.5 meters, you are outdoor, then you can tell your guest as well that you can wear mask, and obviously meron kayong hand sanitizer. Then during the event then or sa gathering na yun, you just make sure na hindi kayo ganong mag-close together, just medyo 1.5 meters. Then I think yun ang pinaka-safe. Alam naman natin na sabi ng New South Wales government, we are up to 20 people. Yung maximum. Yeah? So, I think okay, make it outdoor, stay 1.5 meters, do the basic hygiene, yung hand washing, yung as often as you can. At saka, bring hand sanitizers with you kasi you're gonna be holding or touching things or doorknobs or handrails or things like that. So, make sure na meron kang hand sanitizers. Yeah? And also, if you're wearing mask, please wear it properly, you know? So, kung mag-a-attend ka, pupunta ka sa friend's house, wear it properly. Don't put it down. You know, it makes sure it covers the nose and the mouth, you know, it makes sure it has a good tight seal, and stop touching the mask. Again, hand sanitizer every time you put it on or take it out. And it is not a replacement, okay? Hindi replacement for the safety measures and safety hygiene.
Yes, Michelle, I'd like to add that pag sinabi ni Dr. Logarta-Scott na 1.5, that means 2 arms length. You know, yung hindi lang yung mukhang malapit lang. Oh, mukhang 1.5 yan. No, it's actually 2 arms length. And also, I guess what we have to remember is to wash your hands. Even just the salt and pepper shaker, if one person, his hands are dirty, and you hold that, even a sharing of a pen, even a sharing of a glass, these are the things that we have to remember. Wash your hands, make sure you maintain good hygiene. When you go out, holding of the rails or holding of a plate, you know, you just make sure na alagaan yung sarili nyo na keep in mind, I have to make sure that I wash my hands and that I know that anything could spread. And no one wants to spread this. I don't think anyone wants to share any disease or wants to get sick, anyone to get sick. So we just have to have that responsibility. Also, remember to cough. When you're coughing, cough into your elbow. Kasi not with your, or into your tissue. And then just, some people are coughing, and I know that's why people we're being advised not to go on public transport if possible, but if you do have to, wear a mask if you want to, if you can't physical distance. But also make sure that when you do cough or if you do sneeze, into your elbow or into the tissue, and throw that away and wash your hands.
So, I mean, these are all great tips. Unfortunately, people don't really follow it. Like, we just don't. And it's crazy just having parties and still doing that, right? So I feel like it's the host's responsibility to make sure the party is COVID safe. So maybe they can buy the masks, they can have sanitizers everywhere, make sure that there's like a COVID monitor na 2 arms length ganon. Kasi Filipinos inevitably will give each other a hug, and then that's it. Like, ay, okay lang yan, sandali lang naman. You know, what, Dr. Angelica, what do you think of this idea of sandali lang naman? Is there such a thing?
No. Definitely hindi. Hindi pwede yung sandali lang naman. Yeah? We know na marami namang recommendations of saying hi. You know, you can do this, elbow or feet, you know, many things that you can do other than yung beso-beso or yung pag-hug. I'm sure everyone maiintindihan naman, especially kahit yung mga lola, mga auntie, uncles, maiintindihan naman yan nila na because of COVID, wala na talagang, you know, physical contact is, wag muna.
Temporarily banned.
Temporary,
so,
wag muna.
can you clarify what are COVID-19 symptoms?
So, alam naman natin yung COVID-19, marami na yan siyang symptoms. So firstly, yung mga common symptoms, obviously, yung flu-like symptoms, fever, runny nose, congested nose or scratchy throat, itchy throat, sore throat, body aches, ubo, mostly dry cough. But then, hindi lang yun naman ang simptomas ng COVID-19. Marami na ngayon kahit diarrhea. Okay? So,
wow.
loose motions, abdominal pain, change in the smell, change in the taste of food. That's also symptoms of it. And sometimes, asymptomatic. Yeah? Merong percentage of very rare, a very small percentage na asymptomatic carriers. So, kaya, very we have to be really watchful of our symptoms, especially if you've been to those places na nasa New South Wales website, yung mga places na time and date na doon kayo nagpunta. Okay?
Okay. And then I want to talk about mental health and what people should expect is going to happen in the next 3 months as we're trying to really cope with the emotional aspect of COVID-19. Can you tell us a little bit more about how we can take care of ourselves when we cannot socialize and be normal?
Okay. So in terms of itong COVID-19, hindi lang naman tayo affected physically, but mentally. It causes a lot of distress to people. A lot of people, marami akong pasyente or patients na who are coming or calling because they're having anxiety, depression, and just can't cope because of we can call this a change in life, May mga nawala ng trabaho, may mga nag work from home, but they're not used to it because they're used to seeing people, So, ang ma-advise ko, because this will take a while pa, okay? Before it will go away or before yung vaccine dadating or before talaga tumano, it will take a while. So, firstly is look after themselves. Do things, for example, doing exercises to help replenish those good vibes in them, yung mga good hormones in them. So, doing exercise and make that a habit every day. Okay? Another thing is connection. It's very important. Tayo, mga Pilipino, as a human being, we gusto natin yung connection with our friends, family, relatives. So, maintain that social connection. Zoom, hindi Zoom, yung mga chat,
Facebook video,
Facebook, pa dyan mga methods. Marami ng methods ngayon. At saka, if you know someone sa family ninyo na possibly nadidepress, minsan hindi nagsasabi. Okay? This is the thing. Kasi medyo sa ating kultura, medyo tabu pa iyon, hindi pa nagsasabi na nadidepress na pala sila. Sinasabi lang nila sa mga doctor or yung sa mga, hindi nila sinasabi sa kanilang mga anak, hindi nila sinasabi sa close relatives nila. Pero minsan halata naman ninyo. Meron namang mga signs like medyo aloof sila or bigla na lang na disconnected. Try to give them a ring. Kumustahin ninyo? Maintain that connection. Kilala na naman ninyo ang mga personality ng ating mga, mga relatives, mga kaibigan. Try to just give them a buzz, a ring, and just say, hi, how are you? How are you getting on with the COVID? Be open, yeah? And huwag tayong maging judgmental talaga sa ating mga
bawal
kakilala,
judgmental.
kaibigan.
Okay.
Oo. Kasi we're human beings. Talaga tayo, we go this up and downs of our emotion. At natural iyon, especially ganitong panahon. So yun na yung exercise, connection, at also yung mga other ways na ma-relieve yung mga anxiety and stress ninyo is maybe doing meditations, which I personally do that kasi nga, with the busy things as a mom and as a, doctor, we do meditation para at least, you know, you have that certain peace in your mind, and, you know, it can help you as well. Yeah, it can do great things.
I'd also like to add, Michelle, ang advice din daw, diba, doctor, sometimes when you are watching too much of social media and too much news, you have to also disconnect sometimes, because it can get stressful knowing that so many things are happening around you. Just disconnect sometimes and just understand that, you know your normal life and take care of yourself. Yeah, I think that's important. Yeah. And also like to add, Michelle, that there's looking after your mental health fact sheet in English. It's on our website, and I can send that to you, and you can share that with your on your publication.
Fantastic. And finally, just to wrap things up, can we talk about prevention? I know that a friend of mine is taking vitamin C tablets, vitamin D tablets. Can you give us your top 3 tips on how to stay healthy and hopefully, you know, boost your immune system?
Yeah. So firstly, talaga, obviously, yes, it's true. Now we have to keep our immune system really strong in these times, you know, para naman if ever we get it, or kahit hindi naman COVID, kahit yung rhinovirus lang or common cold, it's very important that mag-ayos yung ating immune system. And one of the things that really can help with our immune system is yung tamang sleep, you know, sleeping right, sleeping well, enough sleep, and also exercising and eating healthy foods. So it's very important na ano yun, covered yun. I know sa ating mga Pilipino, we're very used to yung taking supplements, vitamin C and vitamin D. I'm not against that. It's okay. You take that. Yeah, but obviously, hindi lang yon. Parang additional na lang yon. Kasi hindi lang yun ang mag-improve sa immune system mo. Yun talagang tamang rest, tamang exercise, at tamang pagkain. You know? At obviously, kung wala yung mga emotions dyan or mga anxiety, it helps as well. Okay. Secondly is obviously doing the basics talaga, yung para ma-prepare, protektahan mo yung sarili mo, is if you're working outside, doing the public transport and everything, is to do the basics of hygiene, which is washing your hands, 1.5 meters, social distancing, staying at home if you are yung feeling unwell, para rin hindi ma-spread kung kahit na hindi COVID, again, kahit na yung common colds lang. So, staying in and until your symptoms are gone, and also yung avoiding crowded places, you know, yung pupunta ka sa grocery store, we make sure na you wear a mask and you keep your social distance and avoid yung mga crowded areas. Mm-hmm. And thirdly talaga is, you know, to follow the adherence to the guidelines ng ating government, you know, kung ano yung sinasabi nila na limitation lang, follow those, and those can really protect you and can help you save lives din talaga. Yeah.
Perfect. And Michelle, I think what's important is if you do feel unwell, you have to go get tested. I think a lot of the people are getting scared, natatakot na, oh, baka meron akong COVID, paano kung may COVID, paano yung ano mangyayari sa pamilya ko. But I think the best way of showing love to your family and friends is to make sure that you are safe and that you know if you are infected and that you know that you are not infected. Then you don't have to stress over it. That adds to the stress. I've been tested and I've got tested negative. And I was, you know, I had a bit of anxiety. What if? But I had to follow what we preach in New South Wales Health. And also when you get tested, go home straight away. Don't go to the shops, don't go to McDonald's or whatever, or groceries. Don't, just stay home and get isolated. And then once you get the results, you'll find out if it's negative, then you can do that. Doctor, ano po yung 14 days isolation if you've been if you are close contact or a casual contact?
Yeah, so ganito yun. So firstly is yung merong mga certain areas na tinatawag natin really hot spots or red areas. Now, I think I have the list here, yeah? Pero you can find it naman in New South Wales website. Pero for example na lang yung St. Brendan Catholic Church, Bateman's Bay Shoulders Club, yung Crossroads Hotel. So meaning if you've been in these places on that particular date and time, you need to immediately self-isolate kahit walang symptoms for 14 days. You know, get tested, self-isolate for 14 days. Kahit na negative yung results, yeah? Regardless of the results, 14 days. So that's very important.
Doctor, what's self-isolation? I think a lot of people are wondering, what does that self-isolation mean? Do you have to be separated from your family? I think that's one of the things that people are...
yeah. It's quite, medyo confusing yon. Self-isolation is, kasi ito, hindi ka naman nag-turn positive but self-isolate. It's make sure mo lang, kung halimbawa meron kang kasama sa bahay, is you stay in your room. Yeah? Stay in your room. If ever you're going out, like for example, I mean, not going out the house, but going to the kitchen, or make sure na you have distance, you know? Make sure na yung 1.5, and you limit your contacts. Alam naman natin yung, meron ng difference yung close contact and casual contact. Yung close contact is what we call as you've spent enough time with that person, which is about 15 minutes. Yeah? Yan yung close contact. Tapos malapit. Siguro mga 1 meter to 1.5. Yan yung a distance, and then 15 minutes. So para masabing casual contact lang is less than 15 minutes. At hindi ganun kalapit. Hindi, at least mga 2 meters siguro malayo. So kung ganun ang situation ninyo, for example, is one of your household member has been in this area and they've been self-isolating, I mean, nasa room sila, is obviously yun ang gagawin mo. Malayo kayo, pwede namang same house, doesn't necessarily na umalis siya unless, you know, siguro very unwell na kailangan sa hospital. Pero kung ganun is, hindi kayo mag-spend more than 15 minutes in the same place sa bahay. Hindi sa living room or sa kitchen or ganun. You know, nasa kabilang room siya. Tapos open nyo yung mga windows para well-aerated again ang area. Tapos, so yun yung mga close contact, casual contact, and yung self-isolation for 14 days. Yes. But remind ko lang yung mga tao talaga na, you know, they have been tested and they're waiting for the results. Make sure, you know, i-maintain yung discipline na really to wait for the results. Kasi naman ang results, sometimes it varies, di ba? Sometimes it's 2 to 3 days. But depende yun sa load ng ating mga laboratories because they have been really flooded then with results, with requests yung mga testing kits. So, sometimes, naaabot talaga ng mga 3 days. So, wait lang talaga tayo, be patient, and stay at home and stay safe.
Perfect. Look, I think unfortunately, we've run out of time, but I think we'll do a second session soon. Thank you so much again for your time, Dr. Angelica Logarta-Scott. And thank you, Jess, from New South Wales Health for organizing this for us. On behalf of the Australian Filipino readers, please keep safe because we need you to keep giving us advice and hopefully talk to you again for a second session to learn more about this.
Yes. Oh, thank you so much,
thank you
everyone.
so much, Michelle.
And thank you so much, Michelle and Jess. And till next time.
All right.